This video is for educational purposes only and does not constitute medical advice. Always consult with your healthcare provider before starting, stopping, or changing any medical treatment.
3,063 lawsuits. That's how many legal cases have been filed against Ozempic and Wegovy manufacturers as of January 2026. And yet, one triple board-certified doctor just published a book defending these medications. So what's really going on? Is Ozempic the medical miracle everyone's been waiting for? Or are we witnessing one of the biggest pharmaceutical controversies of our generation? Stay with me because what you're about to learn could completely change how you think about weight loss medications. I'm diving deep into Dr. Rocio Salas-Whalen's new book, Weightless, released in December 2025, and trust me, this is not your typical medical advice. Dr. Salas-Whalen isn't just another doctor with an opinion. She's triple board certified in endocrinology, obesity medicine, and internal medicine. She's been prescribing GLP-1 medications like Ozempic since before they became a Hollywood trend, and she's seen things that most doctors only read about in journals. Here's what makes this interesting. While thousands of patients are suing, while news headlines scream about blindness and stomach paralysis, Dr. Salas-Whalen is doubling down on her support for these medications. But before you think this is just another promotional piece, I need you to understand something. We're going to look at everything. The benefits she champions, the risks the FDA is warning about, the lawsuits piling up, and the science that connects it all together. By the end of this video, you'll have the complete picture that most people never get. So let's get into it. In Weightless, Dr. Salas-Whalen makes a bold argument. She believes that GLP-1 medications like Ozempic, Wegovy, and Mounjaro represent the most significant advancement in obesity treatment in decades. Not just for diabetes, but for obesity itself, which she frames as a chronic disease, not a character flaw. Her position is clear. For years, we've told people struggling with weight to just eat less and move more, as if willpower alone could overcome complex hormonal and metabolic disorders. According to Dr. Salas-Whalen, that approach has failed millions of people, and GLP-1 drugs offer something different, a way to work with your body's chemistry instead of against it. She's watched patients lose significant weight, reverse their prediabetes, reduce their risk of heart disease, and regain confidence they thought was gone forever. In her practice, she's prescribed these medications to hundreds of patients, and she argues that when used correctly, under proper medical supervision, the benefits far outweigh the risks for the right candidates. But here's where it gets complicated, because those risks? They're very, very real. Most doctors won't tell you this, but let me be crystal clear about what we're dealing with here. The FDA, the same organization that approved these drugs, has issued multiple warnings about serious side effects, and we need to talk about them because this is where the lawsuits come from. Let's start with gastroparesis. That's the medical term for stomach paralysis. Imagine your stomach just stops moving food through your digestive system the way it should. We're talking about severe nausea, vomiting, and in some cases, the need for feeding tubes. According to data submitted in the lawsuits, some patients have experienced gastroparesis that persists even after stopping the medication. That's not a temporary side effect, that's a life-altering condition. Then there's the vision issue. In 2024, a study published in JAMA Ophthalmology found a potential link between semaglutide, the active ingredient in Ozempic and Wegovy, and a condition called NAION, non-arteritic anterior ischemic optic neuropathy. In plain English, a form of sudden blindness that has no cure. The study showed that people with diabetes taking semaglutide had more than 4 times the risk of developing this condition compared to those on other diabetes medications. Now, I know what you're thinking. Correlation doesn't always mean causation, right? That's true. But when the FDA adds a warning label, when researchers are calling for more investigation, and when patients are reporting these experiences, we have to pay attention. Here's what else is in the official warnings. Thyroid tumors, including medullary thyroid carcinoma, showed up in animal studies. The FDA requires a black box warning about this risk. Pancreatitis, or inflammation of the pancreas, has been reported in patients taking GLP-1 medications. Kidney problems, including acute kidney injury, particularly in people who become dehydrated from vomiting and diarrhea. Gallbladder issues, including gallstones and cholecystitis. And severe allergic reactions in some cases. This is where it gets interesting. Those 3,063 lawsuits I mentioned, They're alleging that manufacturers Novo Nordisk and Eli Lilly failed to adequately warn patients and doctors about the severity of these gastrointestinal risks. Plaintiffs claim they suffered from gastroparesis, bowel obstruction, and other serious digestive complications that have permanently impacted their quality of life. But wait, there's more. The common side effects, the ones that affect a large percentage of users, include nausea, which up to 44% of people experience, diarrhea, vomiting, constipation, abdominal pain, headache, fatigue, and dizziness. For some people, these symptoms are mild and temporary. For others, they're severe enough to stop the medication entirely. And then there's something most people don't talk about: the rebound effect. Multiple studies have shown that when people stop taking GLP-1 medications, many regain a significant portion of the weight they lost. One study published in Diabetes, Obesity, and Metabolism found that participants regained about 2/3 of their weight loss within 1 year of stopping the medication. That raises a critical question. Are we talking about a treatment or a lifelong dependency? So how do these medications actually work? Because understanding the mechanism helps us understand both the benefits and the risks. GLP-1 stands for glucagon-like peptide 1. It's a hormone your body naturally produces in your intestines after you eat. This hormone does several important things. It signals your pancreas to release insulin when your blood sugar rises. It tells your liver to stop producing excess glucose. It slows down how quickly food leaves your stomach, which is why gastroparesis can occur. And here's the big one. It acts on your brain, specifically the appetite centers, to make you feel full and reduce cravings. Medications like Ozempic and Wegovy are synthetic versions of this hormone, engineered to last much longer in your body than the natural version. Instead of breaking down in minutes, these drugs can work for days, which is why you only inject them once a week. The clinical trial data is actually quite impressive in some areas. The STEP trials, which studied semaglutide for weight loss, showed that participants lost an average of 15% of their body weight over 68 weeks. That's significant. For someone weighing 200 pounds, that's 30 pounds. The Surmount trials for tirzepatide, the drug in Mounjaro, showed even higher weight loss, averaging around 21% of body weight. But here's what Dr. Salas-Whalen emphasizes in her book, and what the science supports: these medications work best when combined with lifestyle changes. They're not magic pills. The most successful patients in the trials were also following reduced calorie diets and increasing their physical activity. The cardiovascular benefits are real too. The SELECT trial, published in 2023, demonstrated that semaglutide reduced the risk of major cardiovascular events by 20% in people with obesity and established heart disease. That's deaths from heart attacks and strokes we're talking about preventing. For people with type 2 diabetes, these medications have shown consistent improvements in blood sugar control, often allowing patients to reduce or eliminate other diabetes medications. Now, here's where the long-term picture gets murky. Most of the major clinical trials have followed patients for 1 to 2 years. Some extension studies have gone 3 to 4 years. But obesity is a chronic condition, and if these medications require lifelong use to maintain weight loss, we simply don't have 20 or 30 year safety data yet. We're essentially in the early stages of a massive real-world experiment. Research is also emerging about effects beyond weight loss. Studies suggest potential benefits for conditions like fatty liver disease, sleep apnea, and possibly even certain types of cancer risk reduction. But again, we need more time and more data to confirm these findings and understand the full scope of long-term effects. The science tells us this: GLP-1 medications are powerful tools that can produce significant weight loss and metabolic improvements in the short to medium term. They can reduce cardiovascular risk in certain populations, but they also come with a risk profile that includes both common, manageable side effects and rare but serious complications. And we're still learning about what happens when people take them for decades. So what would Dr. Salas-Whalen actually tell you to do? Based on her book and her approach to patient care, here are 5 critical steps if you're considering these medications. First, ask the right questions. Don't just ask your doctor, "Can I get Ozempic?" Ask them, "Am I a candidate for GLP-1 therapy based on my complete medical history? What are MI-specific risk factors? Do I have any conditions that would make these medications particularly risky for me?" This includes checking for personal or family history of thyroid cancer, a history of pancreatitis, severe gastrointestinal disorders, or diabetic retinopathy. Second, understand what you're getting into. Read the actual prescribing information, not just the marketing materials. Understand that you're signing up for weekly injections, potentially for years. Understand the financial commitment because these medications can cost over $1,000 per month without insurance. Understand that this isn't a quick fix. Third, monitor yourself religiously. Keep a symptom journal. Track not just your weight, but how you feel. Any vision changes, even subtle ones, need immediate medical attention. Severe abdominal pain that doesn't go away? Persistent vomiting? Signs of an allergic reaction? These are not things you wait out. Dr. Salas-Whalen emphasizes that successful patients are active participants in their care, not passive recipients of medication. Fourth, know your baseline. Before starting any GLP-1 medication, you should have comprehensive baseline testing. This means blood work checking your kidney function, liver function, thyroid function, and lipid panel. An eye exam, especially if you have diabetes. Understanding where you start from makes it possible to catch problems early. Fifth, have an exit plan. This might sound counterintuitive, but you need to discuss with your doctor what happens if you need to stop the medication, whether that's because of side effects, cost, or simply achieving your goals. How will you maintain your weight loss? What lifestyle changes need to be permanent? What's the plan for tapering off if needed? Who should consider these medications? According to current FDA guidelines and Dr. Salas-Whalen's clinical perspective, GLP-1 drugs for weight loss are appropriate for adults with a BMI of 30 or higher, or a BMI of 27 or higher, with at least one weight-related condition like high blood pressure type 2 diabetes, or high cholesterol. But beyond the numbers, ideal candidates are people who are committed to comprehensive lifestyle changes, who can afford ongoing treatment, who don't have contraindications, and who understand they're making a long-term commitment. Who should not consider these medications? People with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, people with a history of severe gastrointestinal disease, anyone who's pregnant or planning to become pregnant in the near future, people who aren't willing or able to commit to regular monitoring and follow-up care, and honestly, people who are looking for a magic solution without lifestyle changes, because that's just not how this works. Let's bring this all together. Here are your key takeaways. 1. Dr. Salas-Whalen's position is that GLP-1 medications represent a legitimate medical breakthrough for treating obesity as the chronic disease it is, not a moral failing. 2. The risks are real and range from common digestive issues to rare but serious complications like gastroparesis and potential vision problems. 3. The science shows significant short-term benefits for weight loss and cardiovascular health, but long-term data beyond a few years is still limited. 4. These medications work best as part of a comprehensive approach that includes diet, exercise, and behavioral changes. 5. If you're considering these medications, you need to be an informed, active participant in your healthcare, not a passive consumer. Here's my final message to you. This isn't about being pro-Ozempic or anti-Ozempic. This is about making an informed choice. Dr. Salas-Whalen has seen these medications change lives for the better. The lawsuits represent people whose lives were changed for the worse. Both realities exist simultaneously, and your job is to figure out which side of that equation you're more likely to fall on based on your individual health profile. As Dr. Salas-Whalen writes in Weightless, the question isn't whether these medications are perfect. They're not. The question is whether, for you specifically, the potential benefits outweigh the potential risks when all other options have been exhausted or proven insufficient. If this video gave you the information you needed to have a better conversation with your doctor, hit that subscribe button. Next week, we're diving into the financial side of GLP-1 medications, including how to actually afford them and what insurance companies aren't telling you. Drop a comment below and let me know. Have you tried Ozempic or any other GLP-1 medication? What was your experience? Your story might help someone else make their decision. Remember, your health is your responsibility, but you don't have to navigate it alone. Get informed, ask questions, and make the choice that's right for you.